Binge eating disorder is a serious eating disorder in which you frequently consume unusually large amounts of food and feel unable to stop eating. For some people, excessive overeating feels out of control and becomes a regular occurrence, crossing the line to binge eating disorder. A binge eating disorder treatment plan is a well-organized and comprehensive approach to treating binge eating disorder. Gathering information about the client's binge eating experiences, setting goals, identifying strategies and action steps for achieving those goals, and tracking progress are all typical components. The main goal of a binge eating disorder treatment plan is to help out the individuals with binge eating disorders in achieving their recovery goals and improving their overall well-being. This could include using cognitive behavioral therapy, mindfulness practices, and nutritional counseling. Non-food alternatives such as exercise, hobbies, or social activities may also be included in the plan to help people manage their emotions and improve their overall health and well-being. If you or a loved one is suffering from a binge eating disorder, it is critical that you seek professional help and support. A comprehensive and structured treatment plan is one of the most effective ways to address binge eating disorder. People who typically use a binge eating disorder treatment plan are individuals seeking to address binge eating disorder on their own, therapists and healthcare professionals, and a family member who's seeking to support someone with a binge eating disorder. To use our binge eating disorder treatment plan, follow these steps. Download the binge eating disorder treatment plan template off our Carepatron platform, which you can find in the description. Fill out the patient's details at the top of the form. Start by filling out the client information section with your name, age, gender, height, weight, and BMI, as well as your contact information. This will help to put your recovery journey into context. Answer questions about your binge eating experiences, such as how frequently you binge, how it affects your life, and what triggers your binge eating episodes. Set goals, strategies, and action steps using the personalized recovery plan table. Start by setting specific goals, such as reducing the frequency of binge eating episodes. Then come up with strategies and action steps to help you achieve your objectives. Identify triggers and coping strategies using the binge eating triggers, coping strategies, and non-food alternatives table. Identify the situations or emotions that set off your binge eating episodes and come up with coping strategies and non-food alternatives to help you deal with them. Use the self-image worksheet table to reflect on changes in self-image as you progress through the recovery process. Before embarking on your recovery journey, consider your self-image, self-worth, relationships, and overall well-being. Return to this table on a regular basis to track your progress and celebrate your accomplishments. Here is a sample of our binge eating disorder treatment plan, which you can find on our Carepatron platform. To find our binge eating disorder treatment plan, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.